Okay, so I'm here today to do a presentation on the cover-up of sepsis, Britain's secret hidden killer. Our son Ben died in April 2015 at Bristol Children's Hospital, and we believe staff have covered up his death and, more importantly, covered up the sepsis aspect of his death. So you will notice I'm now doing the presentation from my living room at home. I was due to be speaking in a presentation in Manchester tomorrow at a sepsis conference. However, my name was removed off the list with days to go because clearly somebody does not want to hear what we have to say. I believe the presentation today is relevant to all families, anybody who knows children, but also to NHS staff that believe that this doesn't go on. I believe that it's important that they realise that the people involved in this cover-up are not only ruining their reputation, but also the reputation of the industry and also the NHS. So I'd just like to start off a little bit of information about Ben. So Ben was born on the 17th of February. He was born earlier, 29 weeks, weighing just under £3, and he was born in Southmead Hospital in Bristol. He spent about 6 weeks in the hospital, all of which went very, very well, very little ventilation requirements and no issues whatsoever. And after about 6 weeks, he was allowed to come home at around about 35 weeks. So during that time at home, he spent 3 days at home with myself and my wife and our oldest son, Nate. And around about the second day of being home, he started to pick up a few snivels. We were informed by the community nurse that this was a normal thing for a child coming out of an intensive care unit. But around about the third day of him being home, his temperature started to drop. We noticed he wasn't feeding. It started to become a little bit pale, so we called NHS 111. We later on that day took Ben into Western General Hospital, where he was later on transferred to Bristol Children's Hospital on early hours on the morning of the 11th of April. So once he'd been in Bristol Children's Hospital, you'll notice that it was discovered he had human metapneumovirus, which was described to us as a common cold or a respiratory illness similar to RSV. And around about the fourth day after Ben was in the hospital in Bristol, he started to take a noticeable turn for the worse. We noticed his temperature was very low. We were constantly complaining about this. It was dipping down to low 34s, and quite often he was left hypothermic for over 12 hours. His ventilation management we also raised as an issue we felt was very poor, and as you can see there, his ventilation leaks on the ventilator were around about 90% some days, with very poor blood gases. So on the 14th of April, we were informed that his deterioration was probably due to a secondary bacterial infection, and we were also informed that patients of Ben's type are sitting ducks for a secondary bacterial infection in an intensive care unit. We were also receiving mixed messages. We were still being told about this, Ben's just got a cold, but also more importantly that this secondary infection was becoming more evident. And as you can see there, from the 15th of April, deteriorating x-rays, they were showing up much worse than somebody with just human metapneumovirus. Okay, I'd like to introduce to this guy. This is William Booth, and he was the ward matron at the time Ben was in there. And on the 15th of April, William Booth said to us, "Ben is of no concern to us. We have children on this ward who are seriously ill and could die." It's important to note that following this, it was 3 days after that Ben actually passed away. Okay, so the final 2 days of Ben's life, the 16th of April, a totally different baby, rapidly deteriorating x-rays, and this sign of yellow phlegm in his lungs. So we were told at the time that blood tests would be taken and blood cultures would be taken to check for this secondary infection that we've been told that the likelihood that Ben had. We were also told that Ben would have a lung culture taken to check his lungs. And again, we were told that antibiotics would be started on the 16th. However, this was something that we've been discussing from the 14th, 15th onwards with the consultants on the ward. Okay, so on this Thursday, the day before Ben died, we were told that he'd taken a huge dip in the wrong direction, and again it was showing this very low temperature in the low 34s. And on the final day of Ben's life, you know, I arrived at the hospital at 5 o'clock in the morning, and Ben was in an absolutely appalling condition, showing very, very bluish grey colour, and I was notified that antibiotics had still not been started at this point, despite us being told on several occasions they would. So Ben was repeatedly desaturating all morning, and he was also being taken off his ventilator and handbagged, which doesn't have the same control level as a ventilator. So despite our numerous pleas with the consultants to come to Ben's bedside, around about 2:30 in the afternoon was the first time that consultants arrived, and at this point we was asked to leave the room while they administered drug. I think at this stage they realised that they'd allowed Ben to deteriorate, and he was in a very, very poorly condition. Following on from the administration of this drug, which was given out of protocol by 2 days, Ben suffered a cardiac arrest at around about 3:45 in the evening, and then we had to sit and watch about 5 hours of procedures where Ben was, you know, treated to remove air from around his heart with a drain, and later on that evening we were informed that Ben had blood poisoning before unfortunately he passed away just after 9 o'clock on the 17th of April 2015. So, in relation to a post-mortem, we asked several times after Ben died, would Ben be given a post-mortem, and we were told that it wasn't necessary, and that hospital staff could sign off Ben's death certificate as they were 100% sure of his cause of death. And we were also told that it is very, very rare to die from human metapneumovirus, but unfortunately it's not heard of. We can also see there, we was never provided with a death summary until about 8 to 10 weeks after Ben had died, which is very, very strange for a hospital. Okay, so if we can have a little look here, this is now Ben's death certificate. So we were told that he wouldn't require a post-mortem, and days after Ben had died, we received the following death certificate. And you'll notice on there that 1A, acute respiratory distress syndrome, 1B, human metapneumovirus, and number 2 is prematurity. So, no sign of sepsis. So why exactly am I here today doing this presentation? So, we can see on there, my presentation, it's about exposing Britain's hidden killer. But the question I want to ask you today is it really the hidden killer? Or is it the killer that is hidden? And hopefully by the end of this presentation, you'll get a full idea of where I'm coming from. So, something doesn't quite sit right. So after Ben had died, we received a death certificate and we noticed that it had acute respiratory distress syndrome on there, and this was something which we hadn't been told of. So we've done our research on this and we found that the mortality rate on this is very high, and that one of the main reasons that children get ARDS is from sepsis. So again, you know, we started to do a little bit more research, but this was the first time we had any knowledge of ARDS. So over the next 6 weeks, we started to take some time and we started to look at why we had not been informed about this, and also whether there was anything else that we hadn't been informed of. So we started to put together some information that we would present to the hospital. Okay, so I'd like to introduce you to James Fraser and Suzanne Dean, who were both paediatric consultants in the intensive care unit in Bristol. And it was these two who we met at the first meeting we had following Ben's death on the 4th of June. So we presented our version of what we believed was important facts that could not only improve the service that was offered to families on the ward, but also areas that we believed were failings. And we were met with a little bit of a brick wall, you know, and a lot of deflecting from the questions we were asking. But there was a bombshell. 50 minutes into the meeting, we were informed that Ben had contracted a secondary bacterial infection called Pseudomonas. Our first response to this was to ask why no antibiotics. You know, we were told 3 days before, why no antibiotics? And in this meeting, we were told by both James Fraser and Suzanne Dean that antibiotics were not given and Ben was not treated for this infection because it was only discovered after Ben had died. We asked consultants when they found out, and both Fraser and Dean both told us that they had only just found out prior to the meeting. Now, this was a slight relief to us because we'd been thinking, you know, Ben had been suffering during them last days, and then to be told that your child doesn't have an infection during them days, it was a slight relief. However, it was just overwhelming that we'd received this information about the bacterial infection. So we did raise our concerns that we were told on the ward antibiotics would be given and they weren't, and that our pleas for antibiotics were ignored. And we were also told, more significantly, we were told that a blood test was taken and blood cultures were taken on Thursday the 16th, which we already know because we'd been told that on the ward, and that they confirmed a negative result showing that Ben didn't have an infection the day before he died. Okay, so at this meeting we were told that antibiotics were finally prescribed and given at 8 PM on the Friday, just 1 hour before Ben died. Again, this was something new to us. We were aware that he'd just not been given them. And we were also told in this meeting that Ben's temperature had been 36 degrees all week. Now, we knew straight away that this was a lie, and this stood out to us like a sore thumb. You know, why would you tell a family that their child's temperature was 36 degrees all week when actually we knew it wasn't, because it was us that had raised the concerns about the hypothermia on several days. I mean, we have charts to show 3 days of hypothermia for over 12 hours. And in a follow-up meeting on the 11th of June, we were again told that Pseudomonas was discovered following Ben's death. So the child death review, which happened around about 8 weeks after Ben's death, and I just want to take you through a few of the points we've extracted from there in relation to sepsis. So Ben had a brief cardiac arrest and then continued to develop severe Pseudomonas sepsis syndrome. Ben did not show signs of sepsis syndrome until 20 to 3 on the 17th, again confirming that the signs were there, and unsure if one dose of antibiotics would change the outcome of severe Pseudomonas sepsis. Moving on, it was felt that Ben's deterioration in the last 8 hours was due to sepsis syndrome developed from Pseudomonas. And again, as we can see here, the Pseudomonas was first isolated in the lungs, and secondary Pseudomonas was discovered in Ben's blood. The death summary: blood and lung cultures after death both grew Pseudomonas, and this likely contributes to the instability and clinical condition. And finally, Pseudomonas sepsis was added to the main diagnosis at the child death review, and sepsis was also added to the cause of death. The registry office was to be updated with positive Pseudomonas results and also probable Pseudomonas sepsis. And again, look there, hypothermia can be a sign of neonatal sepsis. And finally, at the bottom there, we can see, due to the possibility of secondary sepsis, he received antibiotics at 8 PM. So it's very clear from the child death review that the overwhelming, opinion of the consultants there was that Ben died of Pseudomonas and sepsis or sepsis syndrome. Okay, so antibiotics. The death summary stated that antibiotics were prescribed and given at 8 o'clock due to blood results at 6:20. So the actual truth behind that was discovered later on from the medical note, and it was decided to give Ben antibiotics on the Friday after the x-ray round at 11:30 AM. Now, the junior doctor, a lady called Jess Spall, it was her who had discussed this with a consultant, and they decided to give them. However, due to her being busy on the ward, she was dragged from one place to another, and she finally got round to prescribing the antibiotics around about 2:30 in the afternoon, and the prescription chart states chest sepsis. She also stated in a follow-up meeting that staff forgot to prescribe antibiotics and forgot to give them, and that they were given at 8 PM on the Friday night. So actually, they wasn't given because of the results at 16:20 on the Friday evening. They were given because of suspicion of chest sepsis, and this was earlier on in the day. So again, there's pitfalls in the death summary there which are now raising alarm bells, which we needed to look further into. Okay, so if I can now introduce you to the General Manager, Julie Vass, and also the Paediatric Consultant, Margaret Schindler. Now these two were the two people who were present in the third meeting, which was a follow-up meeting following the child death review. And during this meeting, the meeting was held 3 months after Ben had died. Staff were very, very defensive over the care that Ben had been given, and they were very, very dismissive of our presentation of poor care. They were also very dismissive of the secondary bacterial infection earlier on in the week, despite when we were on the ward being told by staff that there was this likelihood that this presentation of this secondary bacterial infection was there. The medical notes also confirmed that they suspected the bacterial infection, and we were informed that the deteriorating condition on the Friday morning, where Ben was a blue or grey colour in the early hours, was the sepsis getting hold of him. Now this was stated by Margaret Schindler, who was the chair at the child death review, and she's telling us that it was sepsis getting hold of him. Now this is over 12 hours before Ben died. During the first part of this meeting, they disputed the need for earlier antibiotics and also admitted that the rising CRP markers had been omitted from the child death review. So the CRP is an indication of infection, and Ben's CRP markers went up from the Monday to the Wednesday to the Friday, and we were told that the trend was alarming for a neonate. But this was omitted from the child death review, and when we asked Margaret Schindler why, she said it was an omission on her part and she didn't know why. So, and this is where it gets a little bit naughty. So if we have a little look over there in the corner, this is a picture from the front page of the Mail on Sunday. Baby death cover up shames NHS. And down in the bottom is a transcript from the section in the meeting. So basically, when we left the meeting and we left to go home, we discovered that the recording that we had for the meeting, you know, both ourselves and the NHS were recording, that the recordings had continued when we left for a break. Now when we listened back to our recording after the meeting, we discovered consultants admitting that antibiotics should have been given around about 3 days earlier because Ben was very poorly. Consultants also admitted in this extra piece of recording that they were sitting quiet and not answering questions, which a coroner would no doubt make them do later on. So after discovering the hospital recording was still on, during this recess in the meeting where we'd left the room, consultant Margaret Schindler asked for the recording to be deleted, as it may get them into difficulty, and the general manager Julie Vass, she agreed by stating, "I will take that out after." So this is NHS staff asking for a recording to be deleted and admitting that a child should have been given antibiotics after just telling the family that that wasn't the case. Now once they realised then that our recording was still going, they can hear fumbling on the microphone, somebody's picked the phone up, and there's a clear attempt made to delete our recording, and eventually the general manager Julie Vass states, "I don't know how to do it without deleting the whole thing." So this again is them trying to delete the second recording. Now because they couldn't delete ours, then you know they couldn't delete their own after. And again, this is again another piece out of the newspaper. Baby death cover up shames NHS. Doctors admitted blunders over 8-week-old son's infection without realising they were being taped, and then asked for the recording to be deleted.
Julie Vass, I'm a general manager at Bristol Children's Hospital.
I'm Margaret Schindler. I'm one of the intensive care consultants and was involved with the child death review process.
This is recorded, so I don't want to use the words, you know, what describes this whole process, you know, but this is absolute balls up from start to finish. You know, from Tuesday onwards, this is a complete and utter balls up from the hospital. I don't care what anyone says. They failed to check the infection after identifying it was possibly there. They failed to treat it after identifying it was there. It is an absolute balls up.
And we said all this before we even knew he had Pseudomonas in the first meeting.
And when we suggested this in the meetings previously, it was dismissed as rubbish. You know, it's only because we've gone away and checked this now to go over this and review all the stuff, you know, forensically, as you might have called it, that we've established these failings. It is absolutely disgusting, and the fact that, you know, we can't have an answer as
7 weeks, it's disgusting.
And this timeline's just the start of it. You know, we haven't even touched on the child death review yet, because everything in there, everything that has happened, and that was a reflection in the death review. This is inaccurate. You know, this is all we have of our child. This is a child death review about our child, and this is inaccurate. Every single section has holes in it, and it's inaccurate. It's inaccurate logging. It's inaccurate information. You know, it's just not acceptable. You know. Maybe this will be time to get a tiny bit of fresh air for a couple of minutes.
Sort out. So
They're absolutely right.
They've got a point.
but I,
You know,
I
these
don't
are-
know
these
what
are
to
not-
say.
These are not
You know,
bullshit. These are not misinformed parents, are they?
but
Okay, so it's whether they want to go through the CDR, and you'll say you've got time. That's going to.
well, I think to go through the CDO, it's going to take about another 2 hours, isn't it?
It's whether, you know, is what we've taken away from what they've already said. So I've got 8 fairly key significant issues here.
I mean,
Is there any possibility of taking off that last?
I'll do that, and I'll go back when we're finished and take that out.
So I just forgot that we're still recording, because that could get us into difficulty.
I don't know how to do it without deleting everything.
Following our third meeting, we found a little bit of information out, and that was at the meeting on the 4th of June with James Fraser and Suzanne Dean. We were told the following: when we took that fluid from the lungs the day before he died, that subsequently grew that bug, we did blood cultures at the same time, and they did not grow anything. They went on to say, on Thursday the 16th, we repeated blood cultures and we repeated infection markers. Furthermore, they said, we grew it from the blood on the day he died, but not from the blood the day before on the Thursday. Now, the cultures we took the day before he died, they didn't grow anything. And because at the time of death, I think everybody in good faith absolutely thought that Ben had died of human metapneumovirus. So, what did we subsequently find after this meeting? Lies, 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 and lies. In actual fact, all the statements in relation to the tests were negative, were all lies. No blood tests were ever taken, no blood cultures were ever taken on them days that they suggested. And this was also despite us being told at the time we were in the hospital with Ben that them blood tests would be taken to check for this secondary infection that they believed Ben had. And at this stage now, our suspicions really started to grow. We've found out that we've been lied to about blood tests, we've been lied to in a meeting that they wanted to delete a recording, and all of a sudden we started to smell a rat. Okay, so I'd like to introduce you to the clinical director for cardiac services. This is Ian Jenkins. And Ian Jenkins was a guy who was brought in at a later stage, 6 months after Ben had died, to carry out an investigation into what had gone on. So, I'd like to take you through about 15 points that the clinical director stated within this meeting. Now, the meeting was recorded, so these have been taken directly from a transcript and are accurate statements word for word. I would like to apologise on behalf of the hospital for our failings. It looks like the staff were trying to convince you that the treatment provided was correct and they were trying to defend themselves. However, during the investigation process, they were reflecting and changing their minds. He went on to say, on Friday morning, Ben was developing an infection there and then, and I am sorry on behalf of us for missing it. There are gaps in Ben's treatment that should have been done, which were not. The only time we would not do daily blood tests would be if a child was stable, which was not the case with Ben. Throughout the week, Ben's temperature was getting too cold too often, which we already knew, we spoke about earlier. We raised the issue about the hypothermia. The medical notes show that, but we were told in that meeting that Ben's temperature was normal. The consultant who had written the death certificate probably did not have the finer details, which is not ideal. Well, you can say that again, not ideal. Somebody writing the death certificate of a child that's just died who doesn't have the details, and he signs it off as 100% sure of how he died. So Ben was getting sicker, and I would have given antibiotics. By the Thursday, I would have banged him with antibiotics. That's very, very, it's not like I maybe would have given them, I would have banged him with antibiotics. And then we can see he says, had he been given antibiotics earlier, he would have stood a much better chance. He has to, doesn't he? Now, this is a very big statement he's telling us. Had the antibiotics been given when he's saying they should, then Ben would have stood a much better chance of surviving. If they'd been given antibiotics the day before, that would have treated him. So he's not only saying that antibiotics should have been given, he's also saying he would have stood a much better chance. And now he goes on to say, had they been given, yes, that would have treated him. And then the final three statements, I apologise on behalf of the hospital that antibiotics were not given in a more timely fashion. The delay was not acceptable. Following my discussions with my colleagues, they all agreed that antibiotics should have been given earlier, and in future they would give them earlier. Now, this investigation was with all the people involved in Ben's care and more, and he states, all of my colleagues now agree antibiotics should have been given earlier. University Hospital Bristol informed us that their threshold for treating a neonate with antibiotics would now be lowered following Ben's case, and this ties in with what Dr. Jenkins had said, that they should have been given, and now the hospital has a different process. And finally at the bottom, following our meeting with the clinical director, we felt much more reassured about the cause of Ben's death. We felt very confident about the information that he provided with us, and we felt moving forward that this was a big, big step in us accepting what had happened to Ben and maybe starting to move forward. Okay, so in December 2015, we received the statements from the consultants to the coroner, and I'd just like to start off with the statement from the microbiologist in December 2015. Damage to the lungs associated with human metapneumovirus led to a direct invasion of the bloodstream by Pseudomonas. Now, I think from the child death review, we'd already established that this was the case. A respiratory sample collected on the 16th at 12:57, which was the day before death, and reported on the 17th at 4:10 grew Pseudomonas. So what stood out for us in this was this statement from the microbiologist was now telling us that Pseudomonas was discovered 5 hours and reported 5 hours before Ben died. Now, we had always been made aware before this point that Pseudomonas was discovered after death, and that's why there was no sign of it in the medical notes, there was no sign of it in the death certificate. The reason that we were told that we wouldn't need a post-mortem because they were 100% certain that Ben had died of human metapneumovirus, and now here we are being told 6 months later that Pseudomonas was discovered before death. Now, the significant part about this is now also pointing towards the fact that hospital staff did know, and that over the previous 6 to 8 months, that in actual fact we've been lied to. And as we can see on the bottom there, it just points out that this is the result, and it shows that on the 17th of April, Pseudomonas was reported at 4:10, which was 5 hours before Ben died. And you'll also notice across the top here, this is a hidden report. So we were sent, we found from the coroner's statements that we'd now discovered Pseudomonas before death, and now we found that it was filed under a hidden report. Now, for the layperson, do hospitals have hidden reports? I mean, what even is a hidden report in terms of a blood test result or a lung test result from a child that has died on an intensive care unit? And the hospital claimed that the reason that they only just became aware of it, we were told this in March 2016, nearly 1 year after Ben died, the hospital claimed that they had just become aware of the Pseudomonas result and the fact that Ben had developed Pseudomonas 5 hours before he died, that they only knew 12 months after he died. So, as you can imagine, at this stage, we're very, very upset, very confused, and it appears our suspicions earlier on, but also the information that we found was very, very true. So, what did we find out later? So, what did we find out after this result? So, despite the claims of the CEO that the result was known on March 2016, this is a comment from James Fraser. If it gets into the blood, it causes collapse, which is how he behaved. The intelligence around the Pseudomonas happened in the latter part of Ben's stay, which brought the consultants to the bedside. So here we are, we're now getting deep into the problem. You know, now consultants are admitting that they knew about it, the intelligence was there, and that's what brought the consultants to the bedside. And a further statement, we only became aware of the bacterial infection when the lung culture came back on the evening, and that's on the 17th of April prior to Ben dying. So now it's becoming very clear that these people knew that Ben had Pseudomonas before he died, despite the claims of the CEO Robert Woolley that they only knew 12 months later. And at the bottom there we can see, you know, these are very, very strange comments that Pseudomonas was discovered before death, and again alarm bells are now ringing much louder. So something is not right. So during a meeting on the 4th of June 2015, we were told what we subsequently found, and it didn't grow whilst he was still with us. We didn't find out until after he died. He grew a secondary bacteria. Well, we now know that that's lies. They also said, I don't know when I don't know whether we knew. It sounds like he doesn't know too much. But one thing that we do know is he knew about the Pseudomonas and they knew about the Pseudomonas. The result was not known by the team within a few days. The result was known by the team within a few days of Ben dying. Well, actually, the result was known 5 hours before Ben died, but they never updated the medical notes, the death certificate, or the death summary to state these facts. And now we can see the date it was reported was on the 18th of April, which we now know is a lie. It was reported prior to death. 8 weeks after Ben died, in the second meeting. So I don't think last week that we knew about the results, but we have now got a better idea now. So they're now saying in the meeting that it was 6 weeks before they knew, and actually they knew before Ben died. So, within hours of the meeting taking place on the 4th of June, where we'd been told these facts that Ben had developed this after death, we later discovered some internal emails. And one of the internal emails, if you can see in the highlighted part there, the lung culture became positive for Pseudomonas on the 16th of April, the day before death. Cultures on this day negative, but became positive just before death on the 17th. So we sat in a meeting for 3 hours. We were told it was discovered after death, and following that meeting, the two consultants in the meeting, James Fraser and Suzanne Dean, went away and sent internal emails stating that they knew before Ben had died. And a second email, Pseudomonas in the lung culture in the PICU unit shortly before death. So everything we've been told was lies. Okay, so if we can have a little look around what happened around the death certificate and the post-mortem, that didn't happen. So it's very clear that there was an attempt made to avoid adding a hospital-acquired infection, Pseudomonas or sepsis, to a death certificate. We now know that they knew about the infection 5 hours before, and we know they didn't tell the family. We know they didn't update the death certificate, and we know that we didn't receive a copy of the death summary for 8 to 10 weeks after. We also now believe that this infection that appeared late was one of several mistakes that the hospital had made, and we believe that this was why they convinced us that a post-mortem wasn't necessary. You know, we asked several times on the evening, would Ben have a post-mortem, and we were told that a post-mortem wasn't necessary and that hospital staff could just sign off the medical certificates as they were 100% sure that Ben died of human metapneumovirus. You know, despite us asking several times about this post-mortem and being told no, you know, we stayed with Ben following his death on the ward. We were then moved into a side room where we were there for maybe 4 or 5 hours while they cleaned him up. Following this, we then carried Ben and moved him down to the chapel of rest. And we moved him, you know, we walked through the ward and down through the general hospital, and then we remained in the hospital on the unit overnight. About 8 months after Ben died, we received several emails from a data protection request, and one of the emails we discovered was from Peter Davis, and Peter Davis was the consultant who signed off the death certificates was 100% certain of the cause of death. And if I can just read through what the email stated. So, the Condons did not ask for a post-mortem. There is no way we could have had that conversation with them. They were just too distraught, particularly Mum. In fact, the wailing and grief was so loud that the rest of the parents left the unit. After half an hour, they left and didn't come back that evening. We discussed the cause of death before I wrote the death certificate. Now, this is utter nonsense. You know, we were on the unit for, like I say, 5 hours plus. So we made a complaint about this, and we received an apology from Peter Davis to state that he apologises that he wasn't aware that we'd asked for a post-mortem because he'd left the unit. So there he is to his colleagues trying to justify the failings of not doing a post-mortem and not updating the death certificate appropriately. And to justify this, he uses us and blames us for leaving the unit and for leaving Ben after just half an hour, when in actual fact it was him. So we just cannot get our head around the logic of why this guy chose to use them words to this colleague. And again, it raises all sorts of concerns about why this behaviour is going on. And if we can just now move on, so following all the meetings, you know, we know that Pseudomonas now is the main cause. You know, the child death reviews unanimously decided that Pseudomonas is the main diagnosis, you know, and that sepsis has been added to the cause of death on the child death review. And we also know that this was a decision what consultants stuck by, and you know, we went to the meetings with Ian Jenkins, who told us that infection should have been treated, and he apologised that they hadn't identified that infection and treated it appropriately, and he apologised for the delay in giving antibiotics and told us it wasn't acceptable. Now, following on from these meetings, we had a surprise, an email from Dr. Jenkins in one of the reports, and it states, I could not say if antibiotics had been prescribed earlier, say on the 15th or 16th, whether that would have changed what happened. Ben died of an ear leak and its effects on his heart. Now, you can imagine our disbelief at receiving this email. So we're now 7 months after Ben's died, and we received an email to state that it wasn't the Pseudomonas, and it wasn't the sepsis, and it wasn't all these things that have been discussed over the past 6 months. It was an ear leak around his heart. Now, this was the first time that we'd been notified that this ear leak had contributed in any way towards his death. And if we can just then move on to a statement from the Trust following this, from the CEO, Robert Woolley. We have apologised to you for our missed failings in care for Ben. We cannot acknowledge that these failings caused his death because there is a genuine doubt that earlier administration of antibiotics would have prevented the pneumopericardium from which he died. So again, the CEO is now echoing the views of Dr. Jenkins that Ben died of this early. But the one thing that stood out like a sore thumb to us here was that the CEO is stating he doubts if an administration of antibiotics would have prevented a pneumopericardium. Well, a pneumopericardium wouldn't be treated with antibiotics. And the air leak was caused by the damage to Ben's lung from the Pseudomonas, which had been left untreated. So this now became a little bit of an issue, and alarm bells really started to ring that the trust had started to now change the story once Dr. Jenkins had admitted that antibiotics should have been given. Okay, so now 14 months after Ben has died, we come to the coroner's inquest, where we believed everyone would be there, would be speaking under oath, and that we would eventually get to the truth. So we know that Ben had this infection. The consultants have now admitted to this in the meetings, and they've also admitted, had it been treated with antibiotics, that he would have stood a much better chance of surviving. We also know there's been a clear attempt to avoid admission of the infection with lies about blood tests, a deleting of the recording. But again, once you come into this stage of the inquest, you believe that justice will be done. So if we can take a little look on the top there. So despite all the information we have, every single consultant who attended the coroner's inquest stated that Ben died of an air leak around his heart, which caused a cardiac arrest. Now, in a previous meeting, we had a conversation with the clinical director, Allyn Jenkins, who told us there is no way we can say that the air leak was there prior to the cardiac arrest. We just do not have clinical evidence. So there's no clinical evidence to say that the air leak was there prior to the cardiac arrest, but yet Dr. Jenkins and the other consultants all state the air leak caused the cardiac arrest, and that's how Ben died, not of an infection. And if we can just go one further down there, this is the statement from both David Grant and Matthew Christopherson, who also both state there was no clinical signs of an air leak 1 hour after the cardiac arrest. So we know there was no signs of it after the cardiac arrest, but yet they're telling the coroner that this is what caused Ben to die. And we believe that this was done in a clear attempt to avoid admission that there was an infection that was failed to be treated. Now, if we also drop down there, we can also see that every single consultant who attended the inquest said that there was never any signs of an infection. Now, we know from the meeting with Allyn Jenkins, he apologised and told us that the infection was developing there and then in front of us, and he apologised for missing it. We also know that Margaret Schindler told us that it was the sepsis getting hold of him, which was the change of colour in the morning. All consultants also at the inquest also stated that antibiotics were never indicated. There was never any reason to give antibiotics. Now, this was again despite Allyn Jenkins in the meeting telling us that he believed they should have been given earlier and they would have worked, and that all of his consultant colleagues agreed with him, and that the hospital has now lowered their threshold for giving antibiotics to a neonate. But yet there they are telling the coroner they were never indicated, they should have never been given. And more importantly, underneath here, antibiotics would have never made any difference. Now, the question asked by the coroner to Dr. Allyn Jenkins was, do you believe that antibiotics would have made any difference? And he responded by saying, I doubt it. Matthew Christopherson, Susie Dean and James Fraser also said no, they did not believe antibiotics would have made a difference. Now, in the previous meeting we spoke with Allyn Jenkins and we asked, would it have made any difference? And he stated it would have given him a much better chance of surviving. It has to, doesn't it? And he went on to say that had he been given the antibiotics, it would have treated him. So a clear obstruction of justice here at the inquest, and clearly lying to the coroner from what we have been told in the meeting. And the coroner believed every single word that was said, and the death certificate remained the same. So despite the child death review stating that Pseudomonas was one of the main diagnoses and that sepsis was one of the causes of death, here we are now at the inquest, and neither of those was to be included on the death certificate because consultants had all colluded to tell this new story that Ben died of an early. And at the bottom there you can see every one of the consultants there stated that sepsis should not be added to the death certificate. And if we can just take a little look here, a couple of final thoughts on the presentation. So if from what you've heard today that you believe that Ben did die of sepsis and that the Pseudomonas was key, which is what we believe, then we must question the accuracy of the sepsis statistics nationally, because this practice of avoiding to reduce hospital stats is clearly You know, it's a practice that's very well oiled. You know, it's clear that this has been done before, and presumably without any action it will be done again. And you can see there, you know, there's been a genuine attempt to reduce sepsis statistics and to cover up Ben's death. But more importantly, from our point of view, and our final thoughts on it are, you know, as a family, your child dies, and there's a clear obstruction of justice in place here from these consultants, but not only the consultants who treated Ben, you know, the likes of Susie Dean and James Fraser, but the people who avoided signing the medical certificate with the correct information, or even updating our family of the infection on the evening, Peter Davis, Matthew Christopherson. And then again, you know, we had consultants lying in the meeting, Margaret Schindler trying to delete a recording, but this goes much higher. You've got the likes of the CEO, who's not given any disciplinary action for any of the issues that's occurred. The lies in about the blood test was something that was said in error. The deletion of the recording was something said in haste. Dr. Jenkins' inconsistencies from the meetings to the inquest, they say that there was no inconsistencies. So we believe that there has been a clear cover-up of Ben's death. And finally, I'd just like to say thank you for listening to the presentation, and hopefully you can sign our petition, Benjamin Condon, at change.org, or follow any updates of ours on Facebook, Benjamin being Ben 2015. Thank you for listening.